My name is Seth Staton, and I lead our healthcare product team at Walgreens Health. We have three big priorities. The first is value-based payments and risk partnerships with health plans and providers. The second is launching and growing our virtual care product. And then the third is Stars and HEDIS performance programs with health plans. A big challenge for us is we need to work with health systems and with plans and partners coming from a traditional pharmacy environment and getting into healthcare. A big piece of it is using the assets and capabilities that we have while also moving into new areas that we haven't historically done. So taking care of patients and engaging them in ways that they don't necessarily expect from us. So one of the hurdles that we're working on is identifying how to engage those patients in a way that they expect Walgreens to be part of their care team. A big thing for us, of course, is because we already have the embedded relationship, we try to meet patients where they are. So when they come into the store, we fire alerts at the pharmacy that let us know that that's a patient that we want to engage more because we have additional services that we can offer them. So that's one step that allows us to leverage the assets that we have in the pharmacy to connect with patients in a new way, an alternative from what they might traditionally do, and then use that as the prompt to catch the patient where they are. Beyond that, we work using our digital footprint because we have millions of patients who've downloaded our mobile app to engage patients through our loyalty program and through the mobile app to nudge patients when they need support for services that we offer. We work with a lot of data partners and obviously also have in-house data from a variety of businesses that we've run over a long period of time. So you think about the scale of the pharmacy business that we have and how much data we have sitting in-house that to some extent is locked into a silo that we need to get out and combine it with other data assets that we have. And so we work with partners to help us connect the dots and unlock data from certain areas. We also have to be very mindful, of course, of HIPAA and regulations around where that data can be used. And so doing that in a prudent, judicious way that allows us to leverage the data that we have while also keeping in a regulated environment is very important. And Innovaccer is one of those partners that we work with in order for us to get more value out of the data that we have. The end user is very important to us. We have a call center that can reach out to patients now, and they do that for med adherence and for care gap closures and for a number of other services that we offer at Walgreens. And what we want to do is empower them further with tools that allow them to do their jobs better, not just for one piece of the puzzle, but for the entire patient 360 view. And so one of the things that we do with all that data that we have is we need to aggregate it together. We have partnerships with health plans and with providers, and we get claims data that comes in. We have the pharmacy data that needs to come in that we already have and generate in-house. And then we have retail data also that allows us to understand patterns of patients coming into the store and using information that way. So what we want to do is take all that together and then equip our case managers and our pharmacists with tools on the front end that allow them to find the right patient at the right time to deliver the right care. One of the biggest things we're excited about is getting to a place with a CRM tool or a customer relationship management tool where we can actually do more of that engagement on a proactive basis. So simple things like emails and text, but in context of when the patient is actually engaging with us, how do we engage back? Or when is the most appropriate time to try to outreach that patient? Things like that, and then using AI tools that help to identify that data in advance and then go and get that patient. That's one of the things we're most excited about. The other thing that we're thinking about is our ability to do incentives and to offer patients products and services that only Walgreens can bring in order to complement the services that a health plan or a health provider would offer to the same patient.